right.
Great.
I'm just enabling you to also record from your laptop if you want, or from your computer.
Okay. Yeah, I would like to record it.
Yes.
So I can now record, isn't it?
Yes, now you should be able to.
Okay. Great.
Is someone else coming to join us?
No, it's just the two of us.
Okay, all right. Okay, so yes, I believe yourself, you're already familiar with OmniSol. I think you've been using OmniSol for some time, I think. Is that right?
No, not really.
Oh, okay.
Yeah. So it's something that I'm also interested in. Maybe you can just go through so that I get an understanding of what it is all about. Then we can.
Okay.
Yeah.
Okay. Yeah, I was actually pretty sure that you were already a client for some time.
No, I'm not yet.
Okay, no, that's fine. That's fine. All right. So, how much do you know about OmniSol as a company so far? I want to establish where I should start.
I don't know much other than the brochure that you sent. I don't know much about OmniSol, but I'm interested in electronic health records.
Right.
Generally, where I work in Harare City, we've got a system that we were using. We are trying to, in fact, we are trying to implement that is called electronic health records, where it's a system that enables us to manage our clients electronically, where if a patient comes in, they are recorded and in an electronic platform, then as you consult them, you write the drugs. By the time they reach the pharmacy, the drugs would already been prepared for them, because the system tells the pharmacist that there is clients also coming through who requires 1, 2, 3 drugs. So this is the system that we currently trying to implement as a Harare City Council. I work for Harare City Council. I'm a doctor with the Harare City Council, but I've also got my own practice, a small practice in Chitungwiza, that I would like probably to have something similar.
Okay.
Yeah.
Okay. Thank you for that background. So let me therefore present. I'll just do a very quick overview of OmniSol and then get into the details of how our solution works.
Okay.
The fact that you already are exposed to a system is good, because then at least the fundamentals of the value of having a computer are already known already appreciated by yourself. So this is good.
Yes.
We don't have to start by selling the importance of electricity over fire.
Yeah, sure.
All right. So OmniSol is a company that's born in Zimbabwe and has been around for over a decade. Or to be specific, has been in healthcare for a little over a decade, but started 1.5 decades ago, 2006. So what we've been specializing in is healthcare solutions. Although our market or our solutions now are slightly beyond just healthcare, they are by far healthcare. So these are some of the brands we work with, who are clients on some level: Premier, ZPC, Emergency Rooms, Red Cross, EMF, Midland State University, CellMed, Minerva, Corporate 24. And here on the bottom right says 1,000 other healthcare facilities in Zimbabwe, right across all the different, all the 10 provinces of Zimbabwe.
Mhm.
So that's the coverage we have. And these are the different sectors from health service providers like yourselves, the funders like medical aids, the members, patients, and the general community. We have something for everyone. There is, just about everyone in society. I think anyone has some interest in healthcare in some way, either healthcare or well-care. When you're well, you still need to take care of that wellness. When you need healthcare attention, you need to take care of that. So either way, we have something for everyone, regardless of what condition they're in. And then some numbers just to give an appreciation of the scale for operations. So we are in just a little over 1,000 healthcare sites across the different disciplines, from pharmacies, doctors' rooms, specialists, hospitals, ambulances, funders, laboratories, etc. Our platform now hosts just a little over 1.3 million patient records, and we've been in the market beyond a trial for over 10 years. And then we're present in 3 countries, but by far mostly in Zimbabwe, our home country. So that's a very quick overview of the company called OmniSol. And the team behind it is 12 people that are full-time employed to take care of the different facets of the ecosystem, which is what we call Utano X. In other words, the healthcare exchange, Utano Exchange. So at this point, I'll go into the actual solution itself so that I can illustrate how it works.
Great.
So I'm
You
going
can
to
go
log
ahead.
out quickly so that I can start from login. So this is a hosted solution. Even though we provide the option to have it on premises, we mostly recommend hosted, because that way you don't have to worry about the infrastructural commitments and the logistics around setting up your own data center and other things like that. Is the fastest as well in terms of going live, and it's also easy and lower cost for everyone because of the shared infrastructure, and it's easy for you to also get a trial, which we may even avail at no cost, so that you can assess for yourself to what degree your operations can be assisted or optimized by our solutions or by our ecosystem. So let me log in. So I just see, if I log in, what you see are the list of modules that are available within the solution.
Okay.
Which you may or may not utilize depending on the nature of your facility. All right, so I'm going to log in. So this is the landing page that also gives an overview of what modules they are and what controls you have. So to quickly illustrate how it works, I'll just walk you through a typical patient's journey. So let me start with capture a patient here. What fund are you on, Doc, yourself?
I'm with Amas because I'm with the city of Harare.
Ah, okay.
Yeah.
All right. So this is interesting. You are aware that Hamas clinics utilize OmniSol? They're on OmniSol.
Really? I haven't actually visited those the Amas clinics. Yeah.
Yeah, Hamas runs on OmniSol. It's been that way for about, it's actually, I would say it's exactly a year actually since they.
Great.
Yeah.
Yeah.
So, all right. Also, so that's your medical aid.
Yes.
Okay. Let me. So while it's these ones you see here, obviously you're familiar with these funders here.
Yes, I know. I know some of this.
However, yes, but however, this is not the limitation of the system. The system covers all funders, including let me say non-conventional. In other words, if you have a private setup, like maybe it's a mining community where you have an internal or in-house funding scheme, that can also be configured. It takes care of any funding model, whether it's sponsored, whether it's cash, all those are catered for. So what you see is a list of what I might call standard or known or common funders, but I can assure you we cover any and all. So I'm just going to pick, I'll just pick Christmas. And then, so the system is already linked with existing softwares used by the funders themselves, so that it is possible to check in real time the benefit status or the membership status of the client that you're about to see, or the patient. So yeah, I'm going to pick one, put in the details. So it's checking with Christmas, and these are the details of that particular member. So it's showing you here that they are on this plan, and the full name as registered as the funder, and it's telling you that the date of birth you entered is not correct, and it's even giving you a national ID, so you can actually ask. So say for example, maybe there's like now it says invalid date of birth. So you then ask for the patient to give you their national ID so that you can verify if they are indeed the bona fide holder of this account, or it's actually they are not supposed to be accessing the benefits. Or maybe there's actually just an error in terms of their record at the funder. Maybe the record is out of date. They just need to update it or something. It also shows you when this person became active, for, when they joined, so that you can calculate things like waiting periods, and the status is currently active, and also when their benefits became accessible, and what is their relationship is with the principal member or the account holder. So
interesting, yeah.
Yes, and these checks are done for all the funders, that.
So you cover all funders in Zimbabwe.
Yes, including like let me just go back. All these that you are seeing here: Cellmed, Siemens, FML, Corporate 24, Peacemaker, Minerva, Maisha, including these are the ones that are not on that dashboard.
Yes. Okay.
And these checks are done in real time for all of them. Well, those that have systems which are capable of that. If the funder does not have such a software, then we then can, because we also have software that runs a medical aid. Like for example, Minerva runs on OmniSol, and Corporate 24 runs on OmniSol. And actually, there's quite a few coming on board as well, because our software for the medical aid side, it has been in live operation since we first got into the medical aid side in 2014, and it was refined over years. And I would say probably the most proper, strong implementation was in 2018, when we had a very, very strong, stable, and dependable medical aid management software. And that's the one that's actually running at Minerva. So we have something for everyone. So what I want to do now is I just want to go back to that client that we're going to use for demonstration here. So I'm going to start a record of an encounter with them. So just to confirm, we scheduled this meeting to be about an hour long. Confirm this is okay with you?
Yeah, it's okay.
Okay. Okay. So what's the nature of your practice in Chitungwiza? Is it a clinic or hospital, or what's
it is a clinic.
Okay.
So we see mostly the outpatients, and sometimes we do 24-hour observations. Not really 24, but daytime observations.
Okay.
Yes, but usually it's just the outpatient clinic that will be running.
Okay. How many beds do you have there for the OBS?
Beds, we've got 3 3 beds for the observations.
Okay.
Yeah.
And I guess that's also for procedures as well.
The procedure is a different room.
Okay.
Yeah.
Okay. You
So
also
go to one room for procedures, then the other one is for observation.
Okay, I see.
Mm.
And how many nurses do you have?
I currently have got 3, but they come on different days. So in a particular day, one nurse will be covering.
Okay.
But we have got 3 of them.
Okay.
Yeah.
I follow. All right, I see. Okay, that's interesting. And do you have a theater as well?
No, not yet.
Okay, follow. I like the response, not yet, because that means this needs
Yeah,
to
so it's
happen
in the
in the
pipeline.
or preferably near future.
Near future, yes.
Yeah, it needs to happen. It's a matter of optimizing operations anyway.
True.
Eventually, you then have even more doctors coming on locums, and you have a more sophisticated administration management, and it becomes a full-scale business. And well, things keep going until this is a force to reckon with right across the entire ward or in the entire district. So it's a matter
True.
of advancing it one step at a time and keep going.
Yes.
Yeah, and by the way, we actually also provide consultancy in administration in terms of setting up administrative structures to manage the business as a business, to make it viable. Because I mean, while it's software for healthcare is one facet of the problem, there are other aspects in terms of probably structuring of the management, things like KPIs, procedures, SOPs for administration, reporting tools, statistics, such things, just to stabilize it as a business and make it viable and be able to predict risks which are of a business nature. So
I would be interested in that, because I really want this thing to be very formal and have the systems in place to monitor. Yeah.
Absolutely. I think what we'll probably do is, I think on Monday we'll have the business consultant engage you as well, and start mapping out the structure of the business as a business, and you can perhaps you can agree on a trial engagement, so that you begin to get a picture of the roadmap that you'd have to follow through for you to take yourselves to be a bigger business establishment. I mean, there's no limit to how big a business can be.
Yes.
All right. So here we are here back on the screen here, looking at a transaction, and on top here is the client details, which primarily the demographics. And here are the transaction history. So on the left here is pretty much the sequence that a typical patient follows as they're getting service, the different stations that they go through. So typically they'll start with vitals, where they get their vitals taken. So let me just put something here. I'll just put what you might call typical vitals. What's the typical respiratory breaths per minute?
Yes, I've just put 20.
20, okay. I was about to put something like 60 or 70.
No, that would be somebody in distress.
Okay.
Yeah.
So if you want to make attachments to substantiate this, you can also put that. So for example, say you have a parallel system where you also have a paper system, you can actually go ahead and still fill out the paper card and just scan it and then attach it.
Okay, okay.
So that way you can sustain both systems, and then the software perhaps helps you to, as an indexing system to help you to quickly identify the location of the paper records. That way you satisfy both a physical need and a digital optimization need. All right, so from there, so you see the next thing is COVID-19, but this is not necessarily like a standard sequence for everyone. But for argument's sake, just because right now it is something that is drawing a lot of attention. If you're doing vaccinations, for example, you can also record that in the system. But the system is already taking care of our vaccinations for a lot of facilities. So you record things like nationality, infection history, exposure, contact history, vaccine brand, first vaccine sender, serial number. We actually have the batches that's been in the country pre-recorded and the expiry dates. Then the verifier, date, sender, in the second shot as well, and also the booster shot records in the case that these are needed, after the IG tests. All right, so that's for vaccinations. And it's actually possible to use this system only for vaccination management, by the way. This can actually be all use it for without necessarily using it for other functions. Even if you don't take medical aid, for example, and if you only take cash, you can actually use this only for that.
Okay.
Right. So then there is a global history, which would consist of history beyond this particular visit to your facility. For example, if just because our facilities, our platform has so many, hundreds of enrolled facilities, it then becomes possible to get access to at least an exposure to where else this patient has been. For example, you can actually see things like, oh, they actually already saw another doctor today.
Somewhere else. Okay.
You see now, and that they probably won't necessarily tell you because maybe they're shopping around, maybe they're looking for a second opinion. Of which I think that's something that's important for you as a doctor to be aware of, that's what's going on. Or maybe you actually want to engage the other doctor to also collect certain notes, certain details, perhaps share notes as doctors. Such things would be valuable from a clinical perspective. So there is a global history. This is where you begin to also derive the value of having of using a system which is used by many other facilities, because then you can draw on a longer electronic health record beyond this one isolated visit that the patient has made to your facility.
So the global history will tell us the treatment history of that particular patient.
Exactly. Because as you can see, it's date, facility name, ICD-10 code, the diagnosis.
Okay.
And because you already know this was Dr. Blah, you can actually engage them directly, and you can also get permission to actually access the full record from the system as well, because it was in this system. So you then can see a more comprehensive and a longer history of the development around this case.
Okay.
All right. So next thing you have
doctor's notes.
Yes. So on the doctor's notes, then you'll be able to see presenting complaints, history of presenting complaints, system review, and you can also have system-specific notes. In other words, if you click this, then you're able to then specify a system. Maybe you want to say cardiovascular, and then make notes specific to this system. So maybe you can say maybe say it's shortness of breath, for example. Oh no, that's not circulatory. That's actually respiratory, right?
Yes.
So maybe here it could be, let's see. Let me see how good my clinical knowledge is. Probably something to do with blood pressure. Or arrhythmias.
Yes, something like that.
Okay, I'm not that bad. Okay.
Yeah, I can see. Yes, yeah.
So maybe if you want to make another observation about another system, maybe gender, maybe
Carries, yeah.
on tooth number, maybe 32. Then perhaps, the point is that you then can cover notes on every one of the systems of the body. You have a very structured clinical report, which then becomes easier for even yourself to make reference to, or when you're perhaps sharing note, maybe when you print it out, it is easier to understand when it comes to you from another doctor or vice versa. And that's the whole idea, to just I mean, that's why we call it utano exchange. That exchange is that's where the value is.
Yeah.
Yes. All right. So what am I looking for here? All right. And then you can also add things like examination findings, which are also system specific if you want them to be. Then I guess a preliminary diagnosis or assessment or impression. You can then put all those notes. And if you want to also make attachments or print this form, you can do that. Or print a card label. Say, for example, say you're making this on maybe there's a paper card system, and you want to make a label that you print out and attach to that, maybe to identify the card record, or as an indexing method to identify where you're going to physically insert it, perhaps in a physical filing system. Or also the use of QR codes as well. So all that is supported by the system. And then from there, say for example, so maybe there's also dental notes. You can also add that as well. Then you can also add tooth-specific notes. They will then pick the tooth number, quadrant, notes before, and the procedure notes after as well. You can also add these. And then perhaps there's a medical history. Such things as whether they've been treated by another doctor, medication, hospitalization, more or less standard questions that are asked about the patient's
the past medical history, yeah.
So all these as well, they can be entered in the system. We actually have another platform that enables the patient to have filled this in by themselves. I mean, since these are questions you're going to ask them, it's actually possible for them to fill these in by themselves before they even talk to you. They can actually go in and fill those in by themselves.
Yeah, that would be interesting.
Yes, that's it's the whole idea is to distribute the workload so that in the end all you have to do is what only you can do.
Yeah.
All right, and the next thing would be investigations. So perhaps you send this person for some blood work, and the tests are already pre-configured in the system. So maybe it's magnesium tests, maybe it's FBC, maybe it's urine MCS. Maybe, I'll just pick a couple of common tests, maybe using these. Yeah, something like that. And then the lab guys will do their work and then enter the results there. So if it is say for example it's a lab that's within your facility, then they just get in and then they don't have to enter the rest of the details that have been entered. All they do is just come in and enter the actual lab results. And once it's done, the moment they save, then you have access to the results. So it becomes a very seamless experience for all the caregivers assigned to that particular case.
But in case you don't have a facility, you send it somewhere and they bring the results, you can enter there.
Exactly. In fact, you can either that even if that facility is actually not part of your facility, because we have many labs that are also using our platform, they actually can post the results onto this platform directly from there, because we also have a lab information system which is used by I think 25 individual labs around the country and outside the country as well. So there's that possibility, or if the results come in as a printout, they can also be uploaded as an attachment to this particular history. All right, so that would cover the investigations. And then after that, then perhaps it's a final diagnosis based on ICD-10.
Yes.
And the system already has the whole ICD-10 library preloaded in the system. So for example, if you just type a keyword like heart, then you find all matches in the ICD-10 which relate to the heart. That way you don't have to actually memorize the whole 34,000 entries in the ICD-10. And this also supports multiple diagnoses per case, per encounter. So that can be done as well. And there's related links to the ICD-10 here, just to facilitate if someone needs to quickly get some additional data regarding the ICD-10 or the ICD, how it works in the first place, because it's sort of new. It's still being adopted in many territories. All right, then from there, you'd give the treatment plan. Basically, you're now giving the instructions to the nurses. So enter that. The nurses come in, and all they do is now they enter their execution of or the administration of the doctor's orders or treatment plan. So probably they just come in and start entering the actual names of the procedures. Now this is important because it is itemized. And being itemized, it becomes easy to then to identify the consumables being used for purposes of billing and also for purposes of stock control. Like this red here is actually a flag showing you that you don't have anything in stock.
Okay.
So they don't have to physically count or check on the on the tray. They can see, okay, we actually don't have anything in stock. So that way they can quickly shop around, like to determine, okay, what do we actually have the consumables to administer right now. So that's how this part works. And then of course this is translated into the billing. So okay, so for example, say maybe there's also a prescription that you're going to add. You can also add that here. So I'm just going to add some medicines here. Maybe I put in amoxicillin, maybe 10, and then we put the instructions here, 3 times a day, for example. Maybe we also put, I don't know, maybe Brufen. Okay. So let's see how good is my medicine. So there's a painkiller and an antibiotic, right? I'm not so bad. See?
Yeah, sure. Agree.
I've been exposed enough to have an idea what these things mean.
Yes, and I know they're also 3 times a day, so you're right. You can, a clinician.
Almost. Unofficial.
Yes. Unofficial clinician.
So now the pharmacy itself, you can actually send an electronic prescription to the patient's phone. All you have to do here is enter the phone number of the patient and send what we call an e-prescription, which is basically a code that the pharmacy, whether they use our system or not, they can actually view the whole prescription that you just entered on their own. And if they want to print, maybe for purpose of medical aid or for their records, they can print it over there as a prescription, because you can actually print it, or they can and it also helps them to say, okay, say for example, because there's a risk with a paper prescription that you can have a patient that's addicted to a certain medicine, so they can try to double like get the same medicine twice, or maybe they're actually selling to someone who's addicted, or you know what things that can happen with addictions.
Yes, I know.
Right. So because the system is keeping track of where the patient has already been to, it therefore can alert the pharmacy that this person already got this medicine from another pharmacy. So it's also in the interest of protecting the patient from themselves or from whatever other medical risks that can occur.
Mhm.
All right, so that's the prescription. And then if, say, for example, you're now going to manage this patient further onwards under admission, whether in your facility or at another hospital, you can also enter the records here on the same encounter to indicate that, okay, they've been, we are admitting them here. Now it depends, of course, on which hospitals you've preloaded that you work with. Data admitted, time, ward, bed number, all these things. You can actually have these integrated in the system, who are the caregivers, special instructions and remarks. And even if you want to print these, perhaps leave them by the bedside for that particular patient, you can also do that. But of course, for your own reference, you then know, okay, I have these patients that are at these facilities that I'm managing while they're over there. And then it goes further. Like say if this was an actual hospital, like the size of a government hospital, for example, like in our case, we actually have our admission hospital actually runs on our system. So we find that all these registers, which are used in a hospital, are already preloaded into the system. And yes, this is actually, I think it's over 70 individual registers, which corresponds to actually to the paper registers that are used in the, in a normal hospital, from the ZP registers, 10 chart, VIAC screening, TB registers, T3s, all those standard registers are already preloaded into the system. And so that makes a very comprehensive system in terms of taking care of the different sizes of facilities that we have that a patient could be given care in. Then you might also want to write a reference letter for another facility, so you can enter those details referred to chief complaint, reason for referral, previous management, investigations done, and these of course can be printed and then sent over to the next facility. Or when you're discharging them, you can also make a record of the discharge, by who discharged them, date, time, assessment, review notes, further management. Then also records of sick. Say, for example, if you make a sick note, you can also make details of the sick leave start date, sick leave end date, the status, whether it's unfit for work, fit for light duty, or fit for work, details of remarks, and also you can also print this, obviously, or add attachments if need be, and then of course the billing. So all these things are not necessarily done by one person, because each station is interested in probably just one of these entries on the left.
Yes.
Like probably the doctor would only be interested in the doctor's notes, and that's it, and perhaps investigations and diagnosis. Then the rest actually ended directly by other units in the facility as the patient's journey. But it's one record which is being populated by the different caregivers. So here, when you come to the bill, it now shows everything that's been added to this, and the billing section now adds the final tariffs. And if there's a need of scanning fingerprint for things that, say, for example, for those that are on Biometric or that are on Health 363, by the way, the Biometric platform is already integrated with our system, so that this can actually be, the claim can be submitted immediately from our system as well. Or if you need to receive the patient, say for a shortfall, or maybe it's a cash patient, or for a core payment, you can actually do the receipting in here, in the system, or whichever currency, and also indicate the method of payment that was done. That was mobile money, cash, swipe, bank transfer, direct deposit, or check. You can also record the cell phone. The system also does an electronic receipt. In other words, it sends an SMS which represents the receipt direct to the client's cell phone, so that they have that record. Reference number or any remarks, it's all included in there. And you can also print this on paper. We recommend obviously the receipt printers for this. And then this is what happens for each patient. All that having happened, you can also record appointments for different patients, for each time slot, for each date.
Mhm.
And then, of course, what makes the system very useful are reports. The ability to make
Yes.
reports and analytics.
Yes, that is very important actually.
Yes, I might say this is probably the ultimate deliverable of any system. If it cannot do reports,
Yes,
you can almost say it's not a report, it's not a system. All
it's
right.
not.
So I'll just run a report here that allows you to filter by different criteria. For example, you can filter by funders. You can filter by
Mhm.
branches if you have multiple branches. You can filter by AFOS numbers. In other words, you can actually have multiple AFOS numbers, and all of them can be reported from one central dashboard. And
Mhm.
also you can filter by different currencies. And you can also filter by those that are cancelled or not cancelled, so that you also know what everything that's happening. So I'm just going to put date going into the past, and I'm going to use as my output currency USD, and I'm going to run the report. And these are the patients I've seen in this time period.
Mhm.
And I can open it again to view all the details of that particular.
Of that particular patient.
Yes.
Yeah,
Okay.
interesting. Mhm.
Yes. And there are many reports. It is an itemized report, reconciled, because obviously you're going to do claims processing, and then receipts listing, control sheets, tax reports, all the cancelled receipts, they stay in the system because no data basically is lost because of audit.
Mhm.
We keep a record of everything, even if it's cancelled, you can still make a report of all invoices that were cancelled because you keep
Yes.
such a record. You can also do revenue by funding. So let me just run this quickly. Just to give you a breakdown of how you're doing, like how the different funders are doing, so you can compare.
Yes.
Say, okay,
Yes,
so these are the
comparing
different
funders.
funders, and these are the clients we're getting in the totals.
Mhm.
This is obviously critical for decision making.
True,
And then you can
true.
do revenue by diagnosis.
Mhm.
So let's run that as well. So you can also see which diagnosis is generating the most traffic. So this can also help you in terms of budgeting or planning of things like maybe want to expand what unit should we add, or what program doctor should we bring on board.
Yes, even what medication to buy.
Exactly,
Yeah.
exactly. That way you don't have expiries too much.
Mm.
So this obviously is useful. Or perhaps you want to assess outcomes.
Mhm.
And then perhaps revenue by age group. You also want to know time for us to have a PID
Mhm.
or a geriatrician. And the numbers will tell you what to do.
Mhm.
So that way you can separate emotion from business reality.
True. Yeah.
So it gives a breakdown by age group, 10 to 14, like groups of 5 years. And from that breakdown, you can see how many clients and what the amounts are for each group. So then you also have, things like daily revenue, weekly revenue, monthly racers, referrals analysis. Maybe you want to see which doctor is bringing us business. Maybe you want to, you want to know where your bread is buttered. So maybe you're making end of year calendars. So you want to know who you should send a calendar, for example. That can be helpful. Then things like stocks, you want reports of stocks, reports of vaccinations, lab results lists. Then I also want to quickly cover the module for claims and data modules, where you have records of where you can see data age analysis by funders, by client, sales reports as well. And you also want to view remittance advices so that you can see, you can keep track of the payments that are outstanding or that you receive from funders, from medical aids. That way you can follow up on shortfalls, outstanding payments. You can see which are the oldest data or owing funds. So this is yeah, there's quite a bit other things to cover as well. This is like the regulatory module. It's like, I mean, there's I mean, for a big hospital, there's even many more modules like tax shop and theater and all these wards management.
So what about the one they've on stocks?
Okay.
Which one is that one?
Yes.
Okay, that one. Okay.
Purchasing. Yes, that's a very important module. So you can also do your products. Management of the product cost and pricing. Request for quotation, purchase orders, supply invoices or GRVs, goods received vouchers. So you can keep track of the orders that you're making from suppliers and the status whether they be supplied or not. So for example, here you can see who among your teammates originated this particular this particular batch or this particular order, and what is the location, where is it going, what's the purpose, with the supplier, date, and then obviously to go through an endorsement process, like someone has to verify this. There's not authorized, under review, authorized, disapproved, or cancelled. There's a signatory. There's date, it's signed, second signatory. You can actually have multiple signatories. I mean, this is money, so the significant grows to make sure that there's accountability in terms of the things that are moving in and out of the facility. And then, of course, the actual details of the items in terms of
just a moment. I want to respond to the knock. Just a moment.
Okay.
It's fine. You can go ahead.
Okay. So the names of manufacturers of which we have preloaded pretty much all worldwide suppliers of most clinical or medical things.
Okay.
Then brand names, whether it's singles or containers, how many each container, count of the units, batch number, expiry date, unit costs, and you can download this file as well. So all these records would be there. And then, of course, using that, you then keep a record of stocks and purchasing. I mean, it starts from a request for quotation, purchase order, then when it's delivered, your supply invoices, and all these managed in the system. And also keep records
movement, yeah.
Right, stock movement, product master files. Right, you can also add new products or new consumables. You can upload your product file as well. And then, of course, you can see stock movement report by department, where you have multiple departments in the whole facility. It's like stock valuation reports, stock usage report by client, or stock usage reports, just indicating the products only. All these things.
Interesting,
maybe I can actually just illustrate what these look like. So, for example, if code, item, cost in USD, price as one currency in USD, quantity in stock, therefore the value in the two currencies. It's been designed to take care of two currencies, but of course these currencies can be changed for different facilities. I mean, what our clients get in Botswana and Zambia is quite different, obviously. But the demo clinic I'm using to illustrate is rigged around Zimbabwe. So, all right, that's a quick overview of this module. Questions, please.
Right. My first question is, So far with the experience, how has this been working with smaller units like mine? We on a day we see around 20 to 30 clients.
Okay.
Yeah. Yeah. So how has this been working with smaller units, and have these smaller units continued to use the paper-based, or they have now resorted to the electronic records for the running of the clinic? I'm asking this why, because yeah, it sounds it might be some additional work for the clinician. So I just wanted to understand from your experience what has been happening.
Mm-hmm. Okay, so yeah, I guess because I showed so many features which are sort of geared towards a hospital with multiple departments, it might look like there's a lot of irrelevant things, but I'd say more than about 70% of our clients are fairly, what I might call small to medium. In other words, there are scenarios where the only user is actually one person, and that one person is probably the doctor, or that one person is actually only the billing person, and they actually don't necessarily utilize the whole value chain that I illustrated. Like, for example, they don't have they don't have nurses capturing the vitals. They don't have the doctor entering the doctor's notes. They only have a person who enters the client details and then billing only, and then they use that for claims management. That's probably what a little over half of our users use the system. And then some use a bit more than that. They probably would have one clinical and one billing personnel using the system. And then some would have perhaps three layers, where you have someone in the reception who enters the basic demographics, then someone who enters vitals, and then the doctor. And then typically the next edition would be someone then who comes back to do debtors management, accounts. That would be 4 levels now. And then you have the next typical edition would be the management. That's someone who's not operational. They only come to do management type of reports, overall analytics, just to, they're probably not even involved in the operations of the business at all. They're probably a stakeholder who really just needs to know not details, but just an overview of how to answer the basic question: how is the facility doing? So those are the different levels, but actually most are using very, very, I would say the minimum that they would be using is just billing, just the sales records, sales receipting. In other words, keeping track of the money.
Okay. Interesting. So for the other question on the paper-based and the electronic, if some drop the paper, opting for this?
Yes, actually there is. I can actually refer you to a few doctors. Like, for example, the NECTAK chain runs on this platform, and they probably are responsible for stretching the platform to cater for more and more automation. As they've significantly big goals and wide variety of facilities. So we find that they've automated pretty much the entire process of caregiving, so that they pretty much don't have any dependence on paper.
Okay. Okay, so for starters, yeah, I mean, I think you have an appreciation of the size of our clinic, from what I've told you. In terms of the hardware that is required, what are some of the items that are required?
So because it's hosted, you actually do not require any hardware to start, except, of course, any device that can access the internet. That means if you have a tablet, that's good enough to get you going. If you have a laptop, even in what might be called a student laptop or an entry-level laptop, Nothing fancy. You can actually start with that, or an iPad, because it doesn't matter whether it's Windows or Android or Apple. As long as you have access to the internet, anything that is a web browser, basically, that's the infrastructure you need. And then, of course, internet access. That's the minimum infrastructure you need. But of course, we recommend slightly more powerful. It now depends now on your numbers, on your volumes.
Yes.
If you have a lot of patients, then of course we want you to have laptops that are a bit stronger, that don't cause patients to wait. And also we then also want you to have internet which is fast and which is stable, which is not disconnecting every 2 seconds, but which is very consistent. Like fiber is ideal. But I mean, from the scale of facilities we have, depending on our platform, on our side, we've already made sure that our own servers are very stable, very strong, because our own servers actually hosted in Singapore, and that is actually where most of the world is now been migrating to in terms of data centers, because they've already stabilized the factors around safety, dependability of data centers, from internet access to security, backups, and other modalities that come with setting up and securing a data center. So that's actually where our physical data center is. We tried another territory before that, but we've settled over the past few years with Singapore, because it has proved to be quite dependable.
Okay. Okay. So yeah, in case our system crashes, so this is what you're trying to explain, that there is a backup.
Yes, because we're operating in a fail-safe environment where you have multiple equipment running in parallel to make sure that if one fails, another one seamlessly takes over and the user won't even notice it. Because we are talking about data centers where you have organizations as big as Amazon are depending on. You cannot even imagine the possibility of being down for 1 second.
Yeah, okay.
It's not acceptable.
Yeah. So what is the costs to attach to this? Let's say we do that trial. I will get interested. What is it that I have to pay? Is it a monthly subscription? Do we have a once-off payment?
Okay, so the payment models or the payment options, they vary in terms of the amounts that would be applicable to you. And this, what we do is we ask you to fill in a questionnaire, which I believe you already did. But the questionnaire enables us to quickly assess the scale of your operations, understand what level of resource allocation that is expected from our end in terms of tech support personnel, in terms of hours, in terms of time zones, so that we ensure that you are covered all the time. And of course, you also get to choose what package you want. Most, of course, by default, we kind of assure 24/7, but some are more 24/7 than others. I mean, if you operate in 24 hours, then you actually do need 24/7. But if you only operate in daytime, then you don't really need 24-hour support. So we look at such things, and then we also look at what modules you want to take up. In the menu modules, there's over 35 individual modules that are optional. So we then look at all that. We then make an assessment, and then we propose figures. We have a commercial proposal that you discuss with our accounts team, our accounts and sales teams, and then in your back and forth discussions, you agree on what works for you, and we get going. But this process does not necessarily have to take time. It can all be discussed within 2 hours, actually. I mean, I might have talked about a lot of things, but it doesn't mean it therefore takes forever. All that discussion can actually be done within about 2 hours, and you actually, we sign you up, we get you on board, we get your users scheduled for a training session. Training session can be on site, on premises,
Mhm.
or it can be remote. Of course, remote is the most convenient,
Mhm.
but it's not always the most practical, because sometimes when you have a big team, well, the truth is the most ideal for healthcare is actually on site. So we then
Yes.
make the scheduling, and then people come over and they do the training. Because it also helps when we have a physical appreciation of the workflow that you have on site,
Yes.
as opposed to
Yes,
being
true.
described to us.
True.
It
Yeah.
helps when we actually see, oh, okay, this is where your session, your nursing station is located, and then when we recommend, it's something that's actually hands-on.
Mhm.
So yeah, so what we'll do after this, I think I'll have you discuss with our accounts and sales teams to quickly agree on figures that make sense for you, and we can actually have you live even by the end of the weekend. You can actually be already beginning to use the system.
Okay. Okay. Interesting. So that's fine. So I think that will be an important area to discuss, the issue of the costs. So probably for today, because I've got another commitment, probably for today I might not be able to have that discussion, unless if it's a 10-minute discussion.
It can actually be that short. Maybe what we can do is right after this meeting, which will probably be ending in a minute or two, we then have that discussion. Yes, it can take 5-10 minutes because there'll be a few questions, and besides, for what you described, they are probably most of the questions that I think they have already been answered. So it will then become possible to conclude the commercials within a few minutes, and then get resources allocated for you so that you can actually get going with your trial. Yeah, and then we get going.